Hi everyone. Today's video is going to be about leptomeningeal disease. I was going to wait until October to make this video because, as I'm sure you know, October is Breast Cancer Awareness Month and that seemed like a good time. However, I've gotten a lot of questions here and in other places asking me some questions about leptomeningeal disease, and so I figured, you know what, let's just go ahead, make the video, let people know what to expect, let them know what they can do to help, some places to ask for like mobility aids and things like that. So that's what we're going to be talking about today. Also, I have my laptop here, so if you see me looking down, I'm just reading my notes so that I don't get sidetracked or forget to mention something that I want to mention. First things first, what is leptomeningeal disease? Leptomeningeal disease is free-floating cancer cells in the cerebrospinal fluid and leptomeninges that surround your brain and spinal cord. Leptomeningeal disease is typically a complication of late-stage cancers, meaning that it's not usually a primary diagnosis. Matter of fact, I've not read about it being a primary diagnosis ever, and that's not to say it hasn't happened. It's just not common. Unfortunately, it comes from other cancers that have kind of taken over the body. So we have breast cancer, in which 3 to 5% of women and men with breast cancer will go on to develop leptomeningeal disease. If you are diagnosed with triple-negative breast cancer or lobular breast cancer, you are more likely to develop LMD. We also have lung cancer, both small cell and non-small cell. 4 to 7% of non-small cell patients will go on to develop leptomeningeal disease, and about 11% of small cell lung cancer patients will go on to develop leptomeningeal disease. We have melanoma, which I got cut off there, but about 5% of melanoma patients will develop LMD. We have acute lymphocytic leukemia. 1 to 10% of people will go on to develop LMD. We have non-Hodgkin's lymphoma, which about 5 to 10% of people with NHL will get leptomeningeal disease. Now, most cancers can potentially spread to the brain, and you can also have a primary brain cancer diagnosis. But leptomeningeal disease is different from a typical brain metastases in that cancers in the brain typically have a solid tumor, which can be resected or removed, or can be treated with chemotherapies, radiations, and things like that. Leptomeningeal disease is different. I mentioned earlier that leptomeningeal disease is comprised of just free-floating cancer cells in your cerebrospinal fluid. What that means is, instead of a solid tumor, there are many tiny cells that can create a plaque-like coating on the lining of your brain. It can get into all of the like little nooks and crannies. I'm not sure, I'm not a doctor, I don't know the medical term for some of these things, but basically it can prevent your cerebrospinal fluid from being able to move freely. It can block those things off, which creates pressure on your brain, which I believe is called encephalitis. And that's where a lot of the initial neurological symptoms from leptomeningeal disease come from, that pressure on the brain. Now, my mom was diagnosed with hormonal breast cancer. She did really well for 2 years, and then almost at exactly the 2-year mark, she started having some extreme vertigo and nausea, like uncontrollable, that lasted about 8 weeks. They did find a solid brain tumor on the left side of her cerebellum. They did surgery to remove that. It went really well, and after that she seemed to be doing really well for like about a month and a half. And the first symptom that I personally noticed was a consistent tremor in her hand. Her hand just shook constantly, no matter what. And she seemed to be off balance, but had no realization that she was off balance. And I personally noticed that her eyes seemed a little hazy. That being said, any new neurological issues, things that are persistent and don't make sense, should be reported to your primary care physician, your oncologist especially, and you should absolutely advocate for yourself, push for some tests, things like that, so that you can make sure everything is okay. Leptomeningeal disease can present with honestly any symptoms you can think of. And I wish that that was an exaggeration, but it isn't. It kind of depends which areas of your brain are more affected, as well as your spinal cord, like where the pressure is and things like that. But some of the more common symptoms tend to be excruciating headaches that nothing seems to help, uncontrollable vomiting with or without nausea, because my mom reported that she didn't feel nauseous, she just very suddenly felt like she was going to vomit. Changes in gait, such as stumbling or kind of leaning from one side to another. Vision problems, and that includes sudden loss of vision, double vision, haziness. My mom said things look dirty all the time, so I don't know what that one is, but any changes to vision should be reported to your doctor. Seizures are also a really common symptom. Confusion and changes in mood or behavior, dementia-like symptoms, back and leg pain, which I think can be pretty extreme, but also numbness or weakness in the extremities, especially the legs and the hip area, problems with incontinence, and then any new neurological issues as far as like tremors or twitching, anything like that should be reported to your doctor. Leptomeningeal disease is typically diagnosed using an MRI or a spinal tap, with a spinal tap being more accurate. An MRI can actually miss a diagnosis of leptomeningeal disease if the cells are too microscopic to be seen, whereas a lumbar puncture spinal tap will almost always be able to detect the cancer cells in the cerebrospinal fluid. The prognosis for leptomeningeal disease is not great. With treatment, the average is between 3 to 6 months, and without, it's about a month. Those numbers are changing, of course. I think statistics tend to be about 5 years old or so. And everybody is different. There are people who have lived for a couple of years or more with leptomeningeal disease. I got cut off. My cat ran into the thing. But it was important to me when my mom was sick to know the facts as they are, not to have false hope, not for some sugar-coated version of the truth. I wanted just the truth so that I knew what to expect. So that's what I'm going to give to anybody watching this video, is just the facts. No emotional coddling, just the truth. It's a rough disease, and I think people deserve to know that. So as with most other cancers, the treatment for LMD include chemotherapy and radiation. With chemotherapy, they may choose to do intrathecal, which means that it goes directly into the cerebrospinal fluid using a spinal tap, or something called an Ommaya reservoir, which is like a port that is installed on the side of your head, and they're able to administer the chemotherapy directly through that. The problem with leptomeningeal disease is that a lot of chemotherapy actually cannot penetrate the blood-brain barrier, which is a barrier that protects your brain from everything, any kind of infections or things like that. So it's very hard to get through, and most chemotherapy cannot do that. So intrathecal basically bypasses that by going straight into the cerebrospinal fluid itself. That's all I really have for the medical part of things, but now I want to kind of talk about some other stuff from just my perspective and my experience. First of all, I have a theory on how I believe my mom developed leptomeningeal disease, and this is not scientific. I have no proof. I have nothing. This is just what I think. I believe that when they went in and removed the tumor on her cerebellum, I believe that either there was some slight mistake made, or even if there was no mistake made, I believe that that allowed some cancer cells to leak into her spinal fluid. And I think it spread from there. So again, that's just my theory. I have no proof of it. I will never have proof of it. That's just what I think. I wanted to mention that there are some places that you can go to ask for help with items that will make things easier as a caretaker of someone with LMD or any issues. You can go to the cancer center, and sometimes they'll have things that you can borrow. If they do, some things that I suggest getting, I wrote these down. Sorry. A shower bench, if you have room, not a shower chair. The bench sits half in the shower and half out, and you can like easily move the person along the bench to get them out of the shower more easily. a lift chair, which is how it sounds, a chair that automatically lifts up to help move someone who cannot stand on their own or can't stand very easily. Slide bars, I'm not sure what those are actually called, but again, you use it to transfer a person, say, from the bed to a chair or whatever, just easier to slide them. Wash tubs, so that you can easily give them bed baths. Along with that, they have something called shampoo caps. You can buy those, or some places, my mom's cancer center. I keep getting cut off, but yeah, my mom's cancer center was able to give us a lot of items that we didn't have to pay for, like the things that I mentioned, plus the shampoo caps you can buy obviously on Amazon. I don't think they're too terribly expensive, but they did also give us things like adult incontinence products and just things like that, as well as like gait belts, which are extremely helpful in making sure a person doesn't fall. A transport chair, we actually were able to get 2 of them. A hospital bed, fidget toys, which you'd have to buy those yourself from like Walmart or wherever, but fidget toys, because my mom liked to just play with things. Like she would sit and just pick at a blanket or at a little stuffed animal, things like that. She needed to keep her hands busy, so a fidget toy would have been a great thing to get. Another thing my mom really enjoyed before things got too bad was coloring. We bought her coloring books and I just gave her some colored pencils, and she would just kind of sit there and scribble on the page, but it kept her distracted and kept her from trying to get up out of bed or off the chair, so that she didn't hurt herself. So those are just some ideas. And that's really all I have to say. My final point is just this. Please advocate for yourself and your loved ones. We want to believe that doctors have our best interests at heart, and some of them do, but not all of them. And at the end of the day, no one cares more about you and your loved ones than you. So please stand up for yourselves and for them, especially the people who can't stand up for themselves anymore. It's so extremely important. I did want to talk about kind of the progression of things in my mom's case. So it started with her becoming off balance again after that problem had been fixed from the primary tumor in her brain. It came back and she fell a couple of times and was taken to the ER. After that, she became extremely confused. Like, she was still in good spirits at this point, but she was very confused. Her thoughts were no longer coherent. She couldn't keep up with the conversation anymore. She didn't remember a lot of things. She basically had dementia very suddenly, overnight, it seemed like. That was really hard, but that was one of her symptoms. After that, she became increasingly weaker. Her legs became extremely weak to the point where she could no longer stand. Even with assistance, her legs would just buckle. She developed sundowners, which means basically the dementia got a lot worse at nighttime. She became not violent, but agitated, definitely. She eventually lost interest in speaking, and then the ability to speak went away. She stopped eating and drinking, and then she passed away. So that's just her experience. There are obviously all different scenarios possible, but that is what happened with my mom. She did have incontinence issues. She had no pain, thankfully. I'm beyond thankful for that. But yeah, so that's that. If you feel like something doesn't seem quite right with yourself or your loved one, please just demand whatever tests you can. My mom's doctors kind of wrote things off a couple of different times, and maybe if they hadn't, things wouldn't have ended up where they did. So please always go to your scans and your blood work. Please make sure that you do everything you can to stay on top of your cancer diagnosis. I wish that all of you would go no evidence of disease. I wish that all of you would live long, happy lives. And that's it for me. So thank you guys for watching. If you have any questions that I didn't answer, please comment below and I will absolutely answer them. And if not, I hope you're all doing well. And I'm sending you so much love. Bye for now.